Hi, my name is Jessica Chastka, and I'm a pelvic floor physical therapist at Sullivan Physical Therapy. I'm going to talk to you today about incomplete bladder emptying. Now, there's several different things that could constitute incomplete bladder emptying. One could just be that you constantly feel that you haven't emptied, even though you just went an hour ago and you felt that you emptied at that time. One could be that maybe you have a leakage right after you void, even though you just went and just feel like you emptied your bladder. Another one could be that you have to go several times in a span of 10-20 minutes or so before you feel like you do. All of those things are signs of incomplete bladder emptying, and those are all things that we can address. Now, as a physical therapist, how would we address them? There's a few things that could cause difficulty emptying. One would be that you have too much pelvic floor tension. And so your urethra goes through your pelvic floor. If your muscles are too tense around that, it doesn't allow for urine to go through the urethra and for you to expel it. So sometimes we have to work on that tension. We'll help you work on it, teach you how to relax the pelvic floor so that you can better empty your bladder. Now, on the opposite side of that, being pelvic floor weakness, sometimes people, if their pelvic floor is too weak, they cannot support their bladder. Their bladder's kind of falling. It's not in the place that it should be. It doesn't allow for it to work how it should. So sometimes people need pelvic floor strengthening exercises as opposed to pelvic floor relaxation. That's something that we can help you determine and work with you. There's lots of also kind of behavioral things that you can do to address incomplete bladder emptying, whether that be taking deep breaths or doing Kegels after you void. That is something that you can talk to your pelvic floor physical therapist about in order to help you empty better. Thanks.